We welcome viewers from around the world to our educational channel. This video is created for a general audience and is on the topic of eye health and specifically glaucoma, a global health issue. When was the last time your healthcare provider checked the pressure in your eyes? For most people, the answer is never. In this video titled Glaucoma, a closer look at protecting your vision, we want to change that by helping you protect your vision and keep your eye on the prize. Please note, the information in this video is for educational purposes only and is not a substitute for professional medical advice. Don't forget to subscribe, like, and share. The learning objectives are on your screen. By the end of this video, you should be able to describe the global burden of glaucoma, including prevalence and projected growth. Identify regions and populations at highest risk. Explain major risk factors for glaucoma, with emphasis on high eye pressure. Recognize the importance of early detection through regular comprehensive eye exams. Outline key prevention and management steps to protect vision and slow disease progression. On your screen are useful resources for eye health. Trusted websites from respected government and health organizations. These links offer reliable, up-to-date information about glaucoma. These resources are a great place to start. Glaucoma is a group of eye diseases that can cause damage to the optic nerve, the nerve that connects your eye to your brain. Damage to the optic nerve can cause vision loss or even blindness. Glaucoma usually develops slowly, so you may not notice any symptoms at first. The only way to know for sure if you have glaucoma is to get a comprehensive dilated eye exam by your healthcare provider. There is no cure for glaucoma, but finding it early and starting treatment can help protect your vision. Glaucoma is the second leading cause of blindness worldwide. Only cataracts cause more blindness, but vision loss from glaucoma is permanent. Going by data in 2020, over 76 million people were affected globally. This number is projected to exceed 110 million by 2040, driven by aging populations. There is a disproportionate burden in certain regions, with a higher prevalence in Africa, Asia, and Latin America, with African descent populations at greater risk for severe disease and earlier onset. It has a silent progression. Many people remain undiagnosed until advanced stages, especially in low-resource settings without regular eye screenings. It causes economic and social costs with loss of independence, reduced quality of life, and billions in lost productivity and healthcare costs globally. Glaucoma affects approximately 3 million people in the United States. Results from the Baltimore Eye Survey found that people of African descent were up to 6 times more likely to have glaucoma than those of European descent. Primary open-angle glaucoma is the leading cause of blindness in African Americans and is 6 times more likely to cause blindness in this group than in European Americans. It tends to appear about 10 years earlier and progress more quickly. The main risk factor is ocular hypertension, high eye pressure, which often develops about 12 years earlier in African Americans, with more cases progressing to glaucoma. Studies in other parts of the world, such as in East Africa, the West Indies and Barbados, also show high rates of glaucoma in people of African descent. On your screen is a graph of prevalence of glaucoma by age and race in the US. Here are the key takeaways. Prevalence rises sharply with age for all groups, especially after 60 years of age. African American population, depicted by the red bars, have the highest rates at every age group, with a particularly steep rise after age 60, reaching over 10% in those aged 80 plus. Hispanic population, depicted by the green bars, show the second highest prevalence in older age groups, especially from age 70 years. White population, depicted in the blue bars, have consistently lower prevalence than African Americans and Hispanic population until age 80 years plus, when their rates increase notably. Other groups, yellow bars, and the overall population average, grey bars, fall in between. How is eye pressure measured? Eye doctors check eye pressure with a test called tonometry. This can be done in different ways. With a small device that gently touches the eye, a quick puff of air, or a portable tool for quick checks. The global reference value for eye pressure, as determined by eye specialists, is between 10 and 21 mm of mercury. Higher readings may increase the risk for glaucoma. Consult with your healthcare provider for more information. On your screen are the common types of glaucoma. Open-angle glaucoma is the commonest type in the US, affecting about 9 in 10 people. It occurs when fluid drains too slowly from the eye. African Americans are at higher risk, and it can be linked to high blood pressure or diabetes. In African Americans, open-angle glaucoma causes nearly 2 out of 10 cases of blindness. Another common type of glaucoma is called normal tension glaucoma, a type of open-angle glaucoma that occurs even when eye pressure is normal. The risk is higher for people of Japanese ancestry, those with a family history, and certain heart problems. A third common type of glaucoma is called angle closure glaucoma, also called narrow angle or acute glaucoma. In this type of glaucoma, the drainage channel becomes completely blocked, causing a sudden rise in eye pressure. There are other less common types of glaucoma. These are beyond the scope of this video. You may be at higher risk for glaucoma if you have high eye pressure, are African American, Hispanic, or of Asian descent, have a parent or sibling with glaucoma, are over 40 years of age, with risk rising sharply after age 60, have thin corneas, live with diabetes, high blood pressure, or heart disease, have had an eye injury or past eye surgery, use steroid medications long-term, especially steroid eye drops. How often should you test your eye pressure? For most adults, eye pressure should be checked at least once every 1 to 2 years as part of a comprehensive eye exam. But if you're 40 years or older, you have been told you have high eye pressure or have signs of damage to your optic nerve, have a family history of glaucoma, or have diabetes, high blood pressure, or other health risks, you may need testing more often. Remember, only your healthcare provider can tell you how often you should be tested. If you have glaucoma, it's important to work closely with a specialist eye doctor, ophthalmologist, to find the best treatment for you. While glaucoma can't be cured, treatment can help protect your vision and slow the disease. Options may include medications, usually eye drops to lower eye pressure by helping fluid drain or reducing fluid production. Laser treatment, a quick procedure to improve drainage in the eye. Surgery creates a new pathway for fluid to leave the eye when other treatments aren't enough. Your doctor will decide the best plan based on your type of glaucoma, its severity, and your overall health. Regular checkups are essential to make sure the treatment is working. Regarding glaucoma prevention and care, get regular comprehensive eye exams. This is the best way to catch glaucoma early, often before you notice symptoms. Manage other health conditions. Keep diabetes, high blood pressure, and other medical issues under control, as they can increase your risk. Follow your eye doctor's advice. Take medications as prescribed, keep follow-up appointments, and monitor your eye pressure regularly. Protect your eyes from injury. Wear protective eyewear when playing sports or working in hazardous environments. By staying proactive, you can help slow the disease and protect your sight for years to come. Consult your healthcare provider for more information. In conclusion, the learning objectives of this video have been met. We hope you enjoyed this video presentation. If you found this presentation informative and educational, please give this video a thumbs up and consider subscribing and sharing with family members, friends, and colleagues. Your support helps us create more informative and educational content. Until next time, stay strong, stay hopeful. This has been a presentation of Opomulero Media LLC.